I kind of break it all down into three broad topics, and I guess before I even explain that, let's just a real fast anatomy assignment so folks know what it is that I'm talking about when I use some of these terms. So we think about the nasal cavity. That's inside the nose. That's your septum, your turbinates. That's just the nose itself. And then when we say the word sinuses, we're referring to the paranasal sinuses. Those are air-filled cavities that drain into your nose via a tiny pathway. And those include your cheek or your maxillary sinus, your ethmoid sinuses between your eyes, your frontal sinuses up in your forehead, and then there's one in the back called the sphenoid. And so just broadly to think of the nasal cavity itself and then the sinuses that drain into that. So as far as the three main topics that I often try to simplify this into. Number one, there's a problem with the nasal cavity or rhinitis, and that's the lining of the nose, swelling, drainage, allergies being a common example of that. Number two would be it's a sinus problem, that you have inflammation, swelling, infection, polyps, some problem that's happening in the sinus cavities themselves. And then number three is just nasal airway obstruction, that you can't breathe. You're not moving air through your nose for some anatomic reason, such as a deviated septum. There's an area called the nasal valve that can get narrowed. And again, it's just a moving air problem. All three of those can walk in the door with a statement of, my sinuses don't work well. I have sinus problems. And so we got to decipher through and pick which one of those it is.
Maybe just for the viewing audience, what is the purpose of a sinus anyway? Why do we have these fluid-filled? What is the purpose of us having sinuses, and what do they do?
It's a great question, and maybe even a hard question to tackle here on our show. There's a few different theories of why they exist. One is that it's involved with the health of the nasal cavity itself. And there's some air pressures and air concentrations, nitrogen versus other, that are involved with that. Number two, it's thought to be part of what gives us our voice quality. So it gives us our resonance in our voice. If I pinch off my nose, my voice changes. If I let it go, it goes right back to normal. So your sinuses give you your voice quality, which is how we interact as humans. And then number three, they're kind of thought of as protective to the brain. If you took a trauma to the face, the sinuses are meant to take the damage to protect the vital structures, the brain.